Pain management practices handle some of the most complex clinical cases in medicine, yet they face the highest administrative burden of any specialty. 94% of all pain management procedures require prior authorization. According to AMA data, that is the highest rate across the entire healthcare landscape. Securing those approvals consumes an average of 13 hours of staff and physician time every week. That is nearly 2 full business days lost to paperwork before a single procedure occurs. The financial toll is steep. Practices spend roughly $68,000 per physician per year solely on navigating interactions with health plans. This baseline of paperwork is a structural bottleneck. It suffocates clinical teams, restricts patient capacity, and directly strangles practice revenue. Interventional pain management carries hundreds of specific modifier rules, CPT codes, and CMS documentation standards. Staying compliant requires absolute precision. General in-house billing teams without specialty expertise routinely face denial rates of 20 to 25%. For a healthy practice, the industry benchmark is under 5%. When claims are denied or delayed, accounts receivable aging quickly pushes past 45 days. Once a claim crosses the 90-day mark, the likelihood of collection drops below 50%. Relying on generalist staff to handle complex clinical coding creates an environment of massive, entirely preventable revenue leakage. Finding specialized staff to stop that leakage is harder than ever. The current workforce crisis has hit medical assistants and front office roles the hardest, making retention nearly impossible for many independent clinics. The constant churn is expensive. Replacing a single administrative staff member costs between $45,000 and $80,000 in lost productivity, recruiting time, and onboarding errors. When you factor in base salary, benefits, payroll taxes, and those hidden turnover expenses, maintaining just one in-house administrative hire costs roughly $60,800 annually. Practices across the country are overpaying for an unstable operational model that ultimately fails to protect their bottom line. The modern solution is outsourcing these workflows to dedicated, healthcare-trained virtual medical assistants who integrate directly into your existing EHR. These teams operate under enterprise-grade HIPAA compliance and HITRS alignment, with full deployment inside your practice taking just 48 to 72 hours. A single in-house hire costs approximately $60,800 annually. Transitioning that role to a full-time virtual medical assistant costs $21,600, a 64% reduction that saves the practice $39,200 per position. This model immediately stabilizes administrative operations, boosts clean claim rates, and drastically reduces overhead without sacrificing clinical quality. To maintain exact clinical accuracy, a proprietary AI workflow layer runs in the background of every single administrative task. Automated audits and pattern recognition systems identify recurring errors in documentation and rank urgent authorizations before submission. This continuous oversight allows virtual teams to maintain 99% accuracy across high-volume workflows. Stop losing revenue to administrative delays and staffing churn. Visit staffingly.com/demo or call 800-489-5877 to start your 30-day free trial today.